Hello, Assalamualaikum. In previous video, we see the basic physioanatomy of the heart chambers and heart walls and major blood vessels. Now we'll see the journey of arteries after exiting from the heart and how the veins are formed to make the final vein that are coming to the heart. We'll see every blood vessel in separate video. In this video, we will stick to the aorta. Aorta can be seen as the first segment of systemic arterial circulation. It originates directly from the left ventricle of the heart. This is the left ventricle, and here you can see the origination of the aorta. It begins with the aortic orifice. This is aortic orifice, this round thing. This aortic orifice is seen in the base of the left ventricle. It is separated from the left ventricle by the aortic valves. Altogether, these three cusps are called aortic valve. These are semilunar cusps. This is right semilunar cusp, left semilunar cusp, and posterior semilunar cusp. These three cusps combinedly are called aortic valve. So this is aortic orifice that is seen in the base of the left ventricle. Here is what you can locate the aortic orifice. This is aortic valve, and these are semilunar cusps. Three semilunar cusps combine to make a aortic valve. As aorta exits from the heart, it runs upward, and this segment of the aorta is called ascending aorta. This segment of the aorta is called ascending aorta. Then it arches to the left, to the lateral side of the body, and it is called arch of aorta. This segment, the curve of the aorta, is called arch of the aorta. And then it starts to running downward, and this segment of the aorta is called descending aorta. Ascending aorta begins at the lower part of the third left costal cartilage. 1, 2, 3. Third left costal cartilage. It starts at the level of third left costal cartilage, and then it ends at the second costal cartilage at the sternal angle. Here is the sternal angle, which is made by the joint of sternum and second costal cartilage, and here is what the aorta ends. This ascending aorta part is somehow the widest part of the aorta. Ascending aorta gives up two very important arteries that are left and right coronary arteries, and these arteries provide the arterial supply to the heart. These arteries actually spring out at the origin point of the ascending aorta. Here, where aorta is originating, it is giving off the right coronary artery and left coronary artery. These are the blood supply of the heart. Then comes the second part, the aortic arch. The aortic arch begins here where the branchiocephalic trunk is branching off the aortic arch. This is posterior to the right second sternocostal joint. The ascending aorta was ending on the second sternocostal joint, means sternal angle, and here's what the arch of aorta begins with, the branching of branchiocephalic trunk. And this arch of aorta lies in front of the bifurcation of the trachea and terminates at the level of T4 vertebra. And here it gives two more branches, common carotid artery and subclevin artery. This branchiocephalic trunk will branch off in the right subclevin artery and right common carotid artery, but the left common carotid artery and left subclevin artery are separate. So on the right side you will have the branchiocephalic trunk, and on the left side you will have common carotid artery and subclevin artery. Diaphragm divides the descending part of the aorta into the thoracic aorta and abdominal aorta. The part above the diaphragm is called thoracic aorta, and the part below the diaphragm is called abdominal aorta. And this is aortic orifice that is found in the diaphragm to give the way to the aorta. And here aorta bifurcates in the terminal branches, the left and right common iliac arteries. And the bifurcation point of the aorta is at the level of L4 vertebra. This was all for today, and we will see all the vessels of the heart one by one in separate videos. Till then, Khuda Hafiz.